Did you know that just one measles patient can infect up to 18 other people, making it one of the most contagious diseases in the world? What begins as a simple fever and cough can quickly turn into life-threatening complications. Today, let's uncover where measles begins, how it spreads, and most importantly, how we can protect ourselves and our families from it. Friends, measles is one of the oldest and most contagious viral diseases known to humanity. Historically, it was first described around the 9th century, and by the 20th century it was so common that millions of people died from it every year. The measles virus enters the human body mainly through the respiratory system, the nose, mouth, and lungs. Once inside, it spreads rapidly through the air. When an infected person coughs, sneezes, or even breathes, tiny droplets carrying the virus can remain alive in the air for up to 2 hours. This is what makes measles one of the most infectious diseases in the world. A single infected person can pass the virus to 15 to 18 others, which is even higher than the transmission rate of coronavirus. At first, the symptoms look mild. Fever, sore throat, cough, runny nose, sneezing, and red, watery eyes. A few days later, small white spots called Koplik spots appear inside the mouth, an early warning sign of measles. Soon after, the most visible symptom appears, a red rash that begins on the face and gradually spreads down to the rest of the body. This is the stage where the patient is most contagious and can infect dozens of others, especially children, pregnant women, and people with weak immunity. But friends, measles is not just a rash. If it is not taken seriously, it can lead to severe and even life-threatening complications. The most common is pneumonia, which is a major cause of death in measles patients. Another dangerous effect is encephalitis, an infection of the brain that can cause permanent disability or even death. In children, measles can also cause blindness, severe diarrhea, and worsen malnutrition. According to the World Health Organization, between 2000 and 2023, vaccines prevented more than 56 million deaths, yet measles still kills hundreds of thousands of children each year, especially in countries with low vaccination rates. The good news is that measles is 100% preventable. The strongest protection is the MMR vaccine, which safeguards against measles, mumps, and rubella. 2 doses, the first given at 9 to 12 months and the second at 4 to 5 years of age, provide lifelong protection. In addition to vaccination, other precautions like isolating infected patients, wearing masks, washing hands, and maintaining hygiene are also important. Remember, measles begins with a tiny virus, but, if ignored, can end in death. But if we vaccinate, its journey ends before it even starts. Even today, doctors around the world share one clear message: get vaccinated, protect your children, and help eliminate measles forever. Remember, measles begins with a tiny virus but can end in death. By getting vaccinated, you can stop this journey right where it starts. Thank you, because health is the greatest gift of all.